Well, hi, my name's Rich Casey, and I'm a urologist from Canada. I've been in practice for about 35 years and have done incontinence work for the last 30 years, primarily in a community practice. There's a big demand in community practice because the academic centers are backed up and there's huge waiting lists, so there's a good opportunity for us to do incontinence work. I first started doing artificial sphincter because that really was the only thing available in the 1980s. It was the gold standard and it worked for us. It became a bit expensive, and over the years we've explored other options. And I guess since 1990s I started doing the PROACT periurethral peri-bladder neck balloon, and then moved to a adjustable sling called the Adams sling. And my hospital had stopped allowing me to buy the sphincter because it was too costly. When I saw this device about 4 years ago at the AUA, it was interesting because it seemed to be the first change in a device, because the artificial sphincter has been a good device, but it's been the same device for 30 years. The biggest problem we had with the device, the existing sphincters, were erosion, and the device loosened over time. And so many of us who do sphincters would like to see something that we could adjust, because patients would come back and say the device is now loose and they're wet again. And so when I saw this device at the AUA where there was a possibility of adjusting it once it was inserted, it caught my interest. Over the last 2 or 3 years, I've been doing primarily slings and the PROACT balloons, because the type of incontinent patients we're seeing are from the robot centers, for example. There's 2 robots in our neighborhood, and the surgeons there are still working through their learning curve, so we seem to get a number of wet patients as they learn to use the robot. When the Zephyr Sphincter finally came to Canada, I learned it from the people at the company, came and taught me, and I've done 8 Zephyr Sphincters in the last few months. These are patients that I traditionally would have done, put an artificial sphincter in. These are patients I would not have used a sling or a periurethral balloon. So these were patients that were fairly wet. Due to the nature of male incontinence, many of these patients try multiple procedures, and unfortunately, the first 8 patients I had, the first 7 of 8 patients, all had previous procedures done elsewhere. Most of them had perineal slings. And they came to me still wet, many with perineal discomfort and pain from the sling, and they wanted another solution. And so it just so happens that the first 7 patients we did through a transcorporal route, transscrotal. So the patient was laying on their back, I go transscrotal and include a bit of corpora in the sphincter. This is what I used to do when I used the AMS artificial sphincter, and having not had experience with the Zephyr, I thought it would be good to bolster the sphincter with some corpora anyway until I get a bit more experience. It turned out it's fairly straightforward. The device is very easy to use. It takes a bit of fiddling to get the air out of it, but once you've got the air out of it and put it together, it's nice. I like the fact that the cuff is adjustable, and there are not different cuff sizes and different pressure sizes in the cuff, and that I can get a fairly straightforward fit. And the pressure regulating device was very straightforward as well. So the procedure took me almost half as much time as it would have taken me to do an artificial AMS sphincter. And I was initially concerned first about the pump size and how patients might perceive it through the scrotum, because these patients, mostly elderly patients, or at least older patients. But I've been surprised with having my patients back that the guys have little difficulty, because the pump is very sensitive to pressure. Once it's pushed, it deactivates very quickly and it reactivates reasonably fast. So the fact that it's larger actually is an advantage, because the older patients can feel it in their hand, it's firm. And I found that if patients struggled with the previous sphincters, it was because the pump was too small, and occasionally they deactivated by mistake. They'd push the button. This is a difficult device to deactivate by mistake because the button takes a bit of pressure, and it's very easy to use and activate so you can void. So I've had no negative feedback from my patients. Other than that, I've introduced it much like I've introduced the sphincters to my practice. I implant it, wait 6 to 8 weeks before I activate the device, and then I tell patients that it's going to take a few weeks to get used to the device. I have had 2 patients who, after a month after I've activated, have come back and are still somewhat wet. And after x-raying the device, I realized that I needed to put a bit more fluid in the compensation pouch. And I was able to adjust these guys at the hospital using a sterile wipe, sterilizing the scrotum and placing a bit of fluid into the device. It went in very easy. It was easy to find. And both the patients were much better after I had adjusted it. And this makes me happy, because it's nice to have a sphincter that I can put in, and if I'm worried, I can put it in even a bit loose and adjust it and tighten it up at a later part. And it was one of the biggest disadvantages with the previous sphincters, that once it was in, no matter what I could not do anything to make it tighter, it was in, and I had to live with it or put a new device in. This one, there's a little bit of flexibility. I think as I get better in doing the devices, when I approach 20, there'll be fewer that I have to adjust after I've put it in, because I'll get better at adjusting it in the operating room, but it's nice to have that flexibility. Where this is in my practice is in patients that are not candidates for a minimally invasive sling or PROACT balloons. And it would probably about half of my patients would be sphincter patients, the other half would be sling or PROACT balloons. To date, I've been happy with this. My patients have been happy, and I'm going to continue to use it and get more experience.